Hey everyone, in this video I'm going to talk about exam related topics of head and neck part of anatomy. There is a lot to cover in this chapter, but some topics which easily lets us score need a mention. You are free to take screenshots of the slides and ignore my talk, but I suggest you to hear me out if time permits, as I'm going to add extra advice and tips to every topic as to how their answers must be written to get good marks. So without wasting any time, let's start. So the first topic from the short notes part is CSF. The location, production, absorption, the normal content, and the associated clinical aspect needs to be mentioned. Next is circle of Willis. I mentioned about this in the neuroanatomy part also because neuroanatomy like brain and spinal cord are all related to the head part and the associated neck part. So they can be asked from any of the two topics, either from the head and neck or from the neuroanatomy. Next is cerebellum. The parts and the diagram is very important. The muscles of mastication and the muscles of facial expression. The origin, insertion, nerve supply, and action of each muscle needs to be remembered and written in the exam. And not only the origin, insertion, nerve supply, and action, the clinical correlation are also very important to be mentioned about, especially of the facial expression muscles, because they play an important part in Bell's palsy, in the diagnosis of Bell's palsy. And next is dangerous area of face. The diagram is important, although it looks very simple, but what are the veins involved which are connecting it to the cavernous sinus needs to be mentioned, and both the diagrams are important, the venular diagram and as well as the face diagram. Next is Little's area of nose. The diagram is again very important. The number of arteries, the exact name of the arteries with the branches. Like, for example, it's not only sphenopalatine artery, it's the septal branch of sphenopalatine artery. So, the exact branch needs to be mentioned. Then comes the scalp. Scalp is a very important topic. If the person wants to pass you in the exam, he will ask you in the viva or in the theory exam. Or the clinical correlations of the scalp are very important. Like there are some named conditions like raccoon's eye. Next is platysma muscle. Again, the origin, insertion, nerve supply, and action is important. And what is a special feature about platysma that also needs to be mentioned. Then is external jugular vein. The course, the branches, and the surface landmark of external jugular vein is very, very important. Next up is facial vein. Again, the clinical correlation is important with respect to the dangerous area of face. External carotid artery and its branches. It is a very easy topic and very scoring topic. Just know the mnemonic. In my subsequent videos, where I'll be teaching about external carotid artery and its branches, I'll make a mention about the mnemonic, and it's very easy and fun to learn. Next is sternocleidomastoid muscle. Its origin, insertion, surface landmark, nerve supply, and action is very important. External ocular muscles. The external ocular muscles is important with respect to action and the nerve supply, and what occurs if either of it gets paralyzed. Next is carotid sheath. The contents of carotid sheath and the diagram is very, very important. Then comes all the triangles of the muscle like occipital triangle and the other triangles of neck. Then is trapezius muscle. Nothing much to say about trapezius muscle, just the regular origin, insertion, nerve supply, and action. Then comes the supraclavicular triangle. What is the other name of supraclavicular triangle? And the clinical correlation is very important with the diagram. Structures emerging from the parotid gland. These are the structures which are asked in a diagrammatic form, and they are very important from the clinical point of view. So the clinical correlations also need to be mentioned. The internal jugular vein, just like the external jugular vein, uh, needs needs the course and the branches. The Walde's ring is the ring of lymphoid tissues, and the diagram is the main catch point here. and the names of the various lymphoid organs need to be mentioned. Paranasal sinuses. The diagram is important, and the peculiar features of each sinus is important. The development of tongue is not so important, but sometimes they ask in the histology and the embryology part of anatomy. Now, for the topics which will be asked in the long question, nothing much needs to be mentioned about it because it's a long question, right? You have to write each and everything about it. These are the topics from which I can't say about the subtopics because the examiner asks about literally everything like the arterial supply, the nerve supply, the function, the cross section, the placement, the landmarks, and the boundaries, everything. So, same goes with parotid gland also. The tongue and tonsils are important in the sense with the nerve supply and the development. Same goes with pharynx. Cavernous sinus is important for short as well as long question. Contents are also important. What are the nerves? What are the arteries that passes through the cavernous sinus? And the clinical correlation of cavernous sinus is so much important. Then comes the lacrimal apparatus. This is not a common question but can be asked. Then comes fascia coli. This is also not so common but is an important conceptual thing. Then comes the pituitary gland. In association with pituitary glands, sella turcica is very important. The landmarks and the boundaries, the structures related to the pituitary gland are very important. Like the structure superior to it, inferior to it, lateral to it is very important. Next up is cervical plexus. It is as important as brachial plexus in the upper limb. So all the nerves and the connections need to be mentioned. The temporomandibular joint is very important. Like shoulder joint is very important in upper limb. Same goes with temporomandibular joint, which is important in the head part. The jugular venous system is also very important. The landmarks and how the pulsations are affected. All the muscles of the soft palate are important. Their nerve supply is the main important catch. So, this was all from head and neck. There are more videos coming up about important topics from other chapters also of anatomy. Do check them out, they are available in my channel's playlist. Thank you.